I'm going to be showing how I do an exam on a puppy. We usually check the puppies around 6 weeks of age, and we check them, sometimes we check them weekly, and if there's any problems, we note it, but I come to check puppies every week, and then the ones that are the correct age, then we would check them. And I would start by taking my microchip reader and scanning the microchip. It reads the microchip directly in the computer to be more accurate, so we don't get anything incorrect. And then after we do that, we note if the puppy is a male or female. I usually start by picking up the puppy and I look at its belly. And what I'm checking for when I look at its belly is for hernias or any abnormal skin conditions. And then I'll put it down. I usually go do my exam in order, and I start at the head then, and I'll open the mouth. I'll look for the correctness of the bite, and I'll note if there is an overbite or an underbite. I'll open the mouth and check for any abnormalities in there and in the teeth. And then I'll move back to the eyes. I'll make sure the eyes look normal. There's no extra discharge or any abnormalities on the eyes. And then I'll move to the ears. Check for cleanliness and any other abnormalities that we might note in the ears. And then I'll usually move the puppy and I will feel its body to make sure it's good condition, check for any lumps or bumps that we might notice. And then I will move to the legs, feel both legs. In the back legs, I will check for patellar luxation, which is when the kneecap can pop off when the puppies move. And so we check that on all puppies. And then after I do that, I'll take my stethoscope and I'll listen for any abnormalities in the heart or heart murmurs. And I'll check the respirations, make sure the lung sounds clear. And my final check is the toes. I check, make sure the toes all are normal. And that's the full exam on the puppy.